The following program is for informational and educational purposes only. This program does not replace medical, mental health, or psychological diagnosis and treatment prescribed by your personal physician, psychologist, therapist, or other healthcare provider. Please consult your provider for diagnosis and care before beginning or changing any program or idea discussed.
Welcome to Recovery, the Hero's Journey. Your host is Dr. Patricia Halligan. If addiction or prescription drug dependence affects you, directly or indirectly, whether it's you, a family member, or a close friend, stay tuned over the next hour as we explore substance use disorders, process addictions, and prescription drug dependence. We'll be discussing the painful reality behind these disorders and what can be done to help. Now, here is Dr. Patricia Halligan.
Welcome to the second episode of Recovery, the Hero's Journey. Today's episode is Surviving Xanax, When the Doctor Becomes the Patient. I'm your host, Dr. Patricia Halligan. I'm thrilled to introduce you to two of my favorite modern-day heroes, cardiologist Dr. Christy Huff and physician assistant Nicole Lamberson. Severely harmed by benzodiazepines, both of them work tirelessly to spread the word about the dangers of benzodiazepine dependence and the importance of long, slow benzodiazepine tapers. They are indeed true patient advocates for anyone suffering from benzodiazepine dependence or severe protracted benzodiazepine withdrawal. Just to clarify, we're talking about a class of controlled substances known as sedative hypnotics that include drugs like Xanax, Klonopin, and Ativan. We're including the Z drugs also, Ambien, Lunesta, and Sonata, which are similar to benzodiazepines in terms of dependence and withdrawal. Christy Huff, MD, is a cardiologist and director of Benzodiazepine Information Coalition, a nonprofit that educates about the adverse effects of prescribed benzodiazepines. Dr. Huff attended medical school at the University of Texas Southwestern, where she graduated Alpha Omega Alpha. She completed an internal medicine residency at Washington University in St. Louis and a cardiology fellowship at UT Southwestern with a focus in advanced cardiovascular imaging and noninvasive cardiology. Dr. Huff is a fellow of the American College of Cardiology, was a private practice cardiologist in Fort Worth, Texas until 2011. Dr. Huff experienced benzodiazepine adverse effects and injury firsthand after 3 weeks of prescribed Xanax use for insomnia in 2015. Over a 3-year period, she slowly tapered off benzodiazepines utilizing Valium and suffering disabling withdrawal symptoms for the entirety of her taper. Her personal experience led her to realize the serious risks of these medications and the severity of the benzodiazepine withdrawal syndrome, neither of which were emphasized during her medical training. Dr. Huff specifically advocates for better education of physicians regarding the adverse effects of benzodiazepines and how to safely taper patients off these medications. Nicole Lamberson is a physician assistant residing in Virginia. She obtained a BS at James Madison University in 2000 and then went on to complete the Master of Physician Assistant program at Eastern Virginia Medical School in 2004. She practiced in an urgent care and occupational medicine setting until severe illness from benzodiazepine withdrawal syndrome left her unable to work. In 2005, she was prescribed Xanax for work-related stress. Over the course of 5 years, she developed many classic symptoms of benzodiazepine tolerance withdrawal, which multiple psychiatrists misdiagnosed as mental illness. This resulted in prescribed polypharmacy to treat the troubling symptoms of tolerance, including 2 benzodiazepines prescribed simultaneously, a Z drug, an antidepressant, a stimulant, and an antipsychotic. Nicole made the connection between her own troubling symptoms and the medication and immediately decided to withdraw. Unfortunately, lacking the proper guidance or information at the time regarding the absolute need for a slow taper, she was negligently cold turkeyed in a detox center. This ultimately resulted in a severe and protracted withdrawal syndrome that persists to date. When symptoms allow, Nicole writes about benzodiazepines and volunteers her time helping with ongoing benzodiazepine awareness initiatives, including the Benzodiazepine Information Coalition, the Benzodiazepine Action Work Group of the Colorado Consortium, and the World Benzodiazepine Awareness Day. Nicole co-founded the Withdrawal Project, a grassroots community effort of Inner Compass Initiative, and she does marketing, distribution, and outreach for Medicating Normal, the film. As her healing allows, Nicole plans to be even more involved, perhaps either working and or volunteering in some capacity with a focus in prescribed drug withdrawal management and also participating in education initiatives around benzodiazepine and psychiatric drug withdrawal for medical providers in the future. Thank you both for agreeing to come on the show today. Dr. Huff, I wonder if you could begin by sharing your story with our listeners.
Sure. So I was a stay-at-home mom as of 2015, and I was prescribed Xanax around that time because I had a health crisis. I had severe dry eye syndrome, and I was losing my vision. And while we were trying to figure out how to treat that, my doctors prescribed me Xanax to help both with, it was a scary situation. And also I just couldn't sleep because it was so painful. And so I just started taking out 0.25 milligrams of Xanax only at night because I wanted to be cautious and careful with it. Well, about 3 weeks in, I started to develop some new concerning symptoms. I had a tremor and also some anxiety that I hadn't really ever experienced before. And the symptoms were subtle at first. Over time, they did grow worse, but something was terribly wrong. And so I went back to my doctors, and they thought maybe this was some kind of medical condition that could tie into the dry eye syndrome. And so I underwent this whole battery of testing, blood work, MRI, lumbar puncture. Everything came back normal, but I continued to grow sicker. And during that time, I was encouraged to take Xanax, even during the day, no more than I was ever prescribed, but just to help treat this anxiety that I was experiencing. When I really figured out what was going on, that it was this Xanax that was making me sick, I was asked to hold Xanax for one of those medical tests for about 12 hours. And I developed severe withdrawal symptoms. I couldn't breathe. I couldn't swallow, muscle contractures. And as soon as I took a dose, those symptoms all just melted away. So I got online, did an internet search, and Googled Xanax or benzodiazepine. I can't remember what I Googled exactly, but I found the website Benzo Buddies, and it's a web forum for patients withdrawing from benzodiazepines. And what I read there was really shocking. It basically described everything I was going through. So basically, it became clear that my body had become physically dependent on the Xanax and that I was experiencing interdose withdrawal. So basically withdrawal symptoms between doses because the half-life of Xanax is so short. And so at that point, I knew that I needed to come off the medication. Well, I tried to reduce the dose on my own, and I was unsuccessful because the withdrawal symptoms were so severe. And I just want to stop right here and say, what I was experiencing was not addiction. It was, the normal physiologic effects of my body adapting to the drug. And at a certain point, I was just taking the medication to stave off the withdrawal symptoms. So unfortunately, when I went back to my doctors to say, look, I want to get off Xanax and my body's dependent and I need help, they some of them didn't believe me. Some of them treated me like I was an addict. I was told a number of things, like you can't be dependent on the medication because you've only been on it for a few weeks. You can just stop the medication cold turkey, and that's how you can get off. So that certainly wasn't going to work for me, I knew. And I was even given an antidepressant to try to treat some of the symptoms I was having, and that ended up making things worse. So finally, I did find a psychiatrist. I brought him a copy of the Ashton Manual, which is a guide for withdrawing from benzodiazepines. And based on that protocol, we worked together. He switched me over to Valium, and which has a longer half-life and help cover the interdose withdrawal symptoms. And then I was able to do a slow taper from there. I was not able to follow the protocol and the manual because it was just too fast for my body. And so I ended up tapering over a period of 3 years, a little over 3 years. And unfortunately, despite doing such a slow taper, I still experienced a host of disabling symptoms. At one time, I counted up to 80 different withdrawal symptoms.
Oh man,
and it was really profoundly
what a nightmare.
It was a nightmare. I mean, it was just utter hell, and not just the symptoms itself, but they were just utterly disabling. Towards the end of the taper, I could barely care for my basic needs like cooking and taking a shower and driving. So it was just profoundly life affecting.
And if I get you right, this was a very small dose of Xanax for a very short period of time.
Yes. And all I took was 0.25 milligrams for 3 weeks. And then things started to go haywire from there.
Totally unexpected.
Right. I was completely blindsided about what happened.
Had you ever seen this before or heard of this before you developed it?
No, honestly, no, I didn't know. Like I said, I discovered what was going on via the internet, shockingly enough.
Mm-hmm, mm-hmm. Did you learn this in med school? Because I know I didn't.
No, I didn't. I think I was taught two things about benzodiazepines. I was taught, short term, be cautious about prescribing, which is that's good information. And then also about the risk of addiction. But I didn't really understand the difference between physical dependence and addiction, and also how long it can take to taper off the medication.
Right. And this clearly wasn't addiction. I'm glad you made the distinction. This is somebody who took a small amount of Xanax for a 3-week period for, a dry eye to help with sleep and relax you at bedtime. And no history of addiction, didn't take other than as prescribed.
Correct.
And totally debilitated for a 3-year period.
Yes.
How did your family react?
They were, I think they were devastated. I mean, I think my husband got to the point where he just, put one foot in front of the other, and, we got through it, but it was definitely life altering. I had to get a nanny to help care for my child for a while. And I just couldn't function as a mother. So it was devastating.
Oh boy. Yeah. I think the worst thing of this is that nobody can help you until you finally find the psychiatrist who's willing to work with you. Had he ever heard of the Ashton Manual to help you withdraw?
No, he hadn't. I just lucked out that he was willing to listen, and I think that's really what it takes, because I went through a number of providers that just weren't even willing to listen.
Mm-hmm. And for you, what's been the worst thing about having a protracted benzodiazepine withdrawal?
So, beyond the fact that it was just utter torture, and this went on for years, there was a almost 5-year period where I was mostly incapacitated. I would just say how it affected my family and my ability to take care of them. Because like I said, I had to have a nanny to take care of my daughter, and I missed out on years with her. There's a blank period in my memory from like age 4 to 9 of my daughter. And I can go back and look at pictures of her life back then, but that's not quite the same. So I missed out on time with her. And it also affected my daughter as well. She developed very extremely picky eating, and that's something we're still working on today.
Mm-hmm, mm-hmm. Now, the FDA recently amended their black box warning on all benzodiazepine prescriptions. And I know that you've looked at it. In your opinion, Dr. Huff, is the warning clear enough and strong enough? And what would you change about it? Can you talk a little bit about the new updated FDA warning, black box warning?
Sure. So I have a lot of thoughts about this. Just for background, they recently updated the box warning for benzodiazepines to include the risk of abuse, addiction, physical dependence, and withdrawal reactions. Mm-hmm. And this was after they did an extensive review that included the existing scientific literature. And they also reviewed their adverse events database as well. And I was able to obtain there was a 175-page report that they generated and I got that from Freedom of Information request. And I looked over it, and, I saw a number of things that were encouraging. But doesn't necessarily tell the whole story. I'll start with the good things. I was excited to see some of their findings because they aligned with things that benzodiazepine awareness advocates have said for years. The first thing they noted that addiction abuse are mostly in the setting of polysubstance use. So like in combination with opioids or alcohol or other drugs of abuse. But if you're just taking them as prescribed, then the chance of addiction is going to be pretty low. Also, the adverse events can actually occur with prescribed therapeutic use. You don't have to abuse the drug to have adverse effects from the medication. And the withdrawal can be, like in my case, a long process. Some patients in their database were withdrawing over the course of months or years. And then also the abrupt and over rapid tapers are harming patients. Some of the case reports, they noted people were being pulled off the medication too fast and suffering adverse effects from that and severe withdrawal. And so this prompted the FDA to recommend a patient-specific plan to gradually reduce the dosage, which I think is a great recommendation. So, beyond the gradual taper, they also recommended judicious prescribing, which is basically use an alternative to a benzodiazepine or use the lowest dose for the shortest time possible. And I think those are recommendations we can all get on board with, but I do still think there's more work to be done so that the labels clearly spell out the risk. And I think the big thing that I would like to see spelled out more clearly is the severity and the length of time that people who suffer protracted withdrawal, basically this syndrome is, I think, not as rare as they let on, because if you look at Ashton's work, 10 to 15% of people withdrawing from long-term benzodiazepines, which is considered more than 4 weeks of use, they can experience this protracted withdrawal syndrome. And
that's an alarmingly high number.
Right.
And I don't doubt it.
Right.
I think it's probably pretty accurate.
Yeah, I think that's consistent with what we're seeing in advocacy as well. And so, I've known people that have actually committed suicide because of the severity and the ongoing nature of the symptoms. So that's something that I would want to see spelled out in writing.
It never ends, by the way you're talking about it. This is a living hell that just never ends. And there's almost no words that describe. I think it was an English physician, John O'Connor, and he said it's the body becomes its own torture chamber.
That's exactly how it is. And when you're in it, you just cannot see your way out of it.
Oh, it's just excruciating, right? Like inhumane. And I could stand anything for 24 hours. You might be able to push it to about a week, but if you're talking years, I understand why people want to end their life.
Right. And I understand too, having experienced it firsthand, because there were times where I thought about suicide as just a way out. And
especially
if I had not gotten better, that would have been an option. Unfortunately, it was just that bad.
Oh, absolutely. People think I'm going to put my family out of their misery. I'm going to put me out of my misery. It feels hopeless after a while, I would imagine.
Right.
Yeah.
So
what would you change? What would your wording be on this black box warning? I think it was Shane Kenny. He said he would say it's severe. This benzodiazepine can cause severe neurological harm. And I thought, I wonder, how do you get the message across, right?
Yeah, I think I would agree with that, because this is a neurological injury or damage that we're talking about whenever the withdrawal is just going on for months or years. So I think something like that needs to be in the warning.
I think that would be wonderful. And maybe, do they give clear advice on how to taper? I know it has to be patient-led, but do they say what duration of time they should, like a minimum amount of time? Like, yes. I kind of wish they said, at least, look at 9 to 12 months minimum, or, something to that extent. Some people, years and years, like yourself.
Yeah, unfortunately, they don't say anything like that. In fact, if you look at the Xanax medication guide, they list the maximal rate of taper as 0.5 milligrams every 3 days, which is just an insanely fast rate, which probably would not work for anyone.
Nope.
So, so I would like to see something more in line with like what we're seeing in the online support groups, which feedback from those groups suggests, less than 5 to 10% reduction monthly is better tolerated.
Because those people then are less likely to develop a severe protracted withdrawal syndrome, right? If you don't shock the central nervous system, just very, very gradual, and maybe they won't become totally debilitated.
Exactly. That definitely lowers the risk, I think.
Right. Oh, those are some great insights. I love the fact that you encourage people who have been harmed by benzodiazepines to report it. And what good does that do? And how do they report it?
So this is something that's near and dear to my heart because I've spent a lot of time helping harmed patients file FDA MedWatch reports. So here in the United States, we have the FDA MedWatch system. Now, if you're in another country, you hopefully have some other, a similar agency where you can report, but I'm just going to talk about MedWatch. And that can be found on the FDA's website. It's basically their adverse events database. And if you have an adverse event, you should go there and report it. There's also a direct link to it on the BIC website as well. And it's really important to do this because when enough reports are filed, it generates a signal that the FDA is obligated to investigate. And of course, we've already seen this in action because a lot of the findings that led to this boxed warning were from their review of the adverse events database. And before you think that, well, it's closed, the box warning's already out, there's, like I said, there's still more work to be done. So please keep reporting because I've heard that the FDA's Benzo Review Committee is still open. So they're still investigating. So, keep those reports coming. And I'd especially like to see people filing reports that have experienced severe withdrawal or protracted withdrawal and severe outcomes like suicide or disability. And just so anybody can file a report on your behalf. It doesn't have to be the patient themselves. It can be the patient's doctor, family, friend, an advocate. Anyone can do it.
So it might help them feel like they're contributing to fix the problem or improve awareness. It feels like nobody understands. Doctors who tell you just stop it. You're at a low dose. You've only been on it for a couple of weeks. What does interdose withdrawal feel like?
Oh, so mine got to be pretty bad towards the end. My Xanax doses, I was having to space it every 6 hours towards the end before I was able to get switched over to Valium. And my doses would last me between 2 to 3 hours. And then I would be on florid withdrawal. And I'm talking like I had an elephant on my chest and I was gasping for air for 3 hours until my next dose, and my muscles all clamped down and shaking. And it was terrifying.
I wonder why they don't just take Xanax off the market. I mean, it's implicated in 1/3 of suicides. It is the most abusable benzodiazepine. It is highly potent and rapidly acting. I just wonder why they just don't get rid of it.
Yeah, that's a good point because it does. All the benzodiazepines can be bad, but that one, I know at least in my case, was horrible. And I think that the short half-life and the potency leads to all sorts of problems.
Yes, it's the one that the emergency room across the country, the emergency rooms across the country tend to see the most incidents with. It's the most accidents related, the most overdose deaths related, the most suicides related to Xanax. Well, those are some wonderful insights. I really appreciate your thoughts on this and sharing your story.
Sure.
Nicole, I wonder if you'd mind telling the listening audience a little bit about your story, what it was like then, and where you're at now.
Sure. Thanks for having me. And I just want to say I'm having some allergies. So if I sniffle or my throat cracks, that's why. So early in the 2000s, I was fresh out of PA school. And I was having some stress at work, nervousness, just typical. I think in hindsight, just kind of nerves from being a new, PA working in a medical environment and just sort of getting used to all the stress and responsibility that came with that. And so one of the physicians actually that I worked for prescribed Xanax for me. I was feeling sick at work one day and he said, oh, that's just, stress and anxiety. Here, take this. It was, I think, 0.5 milligrams or 0.25, I'm not sure. And just on a PRN basis. So I started taking it. And like Christy, shortly after starting it, I in hindsight, got adverse effects. I believe I was having interdose withdrawal, intolerance very fast, but I didn't put, two and two together as fast as Christy did. Within weeks, I actually believed that something was wrong with me, that I had an anxiety disorder or, I was developing new severe mental health type stuff. So I did seek psychiatric care. I started to see a psychiatrist. I was also having like depression, which I think was from the Xanax. And so when I went to the psychiatrist, of course, they misdiagnosed a lot of the adverse effects that I was having as so-called mental illness. And then I stayed in psychiatric care for the next 5 years. And basically, they added more and more medications, and each new medication came with its own set of side effects and adverse effects until basically I was like a chemical soup. I was on so many drugs and sicker than I'd ever been in my entire life. So after the Xanax, I was put on Klonopin. So that's 2 benzodiazepines at the same time. And the rationale given at the time was that I could take the longer acting Klonopin 3 times a day. And then the Xanax went in between.
That's crazy.
Yeah. I was taking 5 doses of benzo. And then at night, she added Ambien for sleep.
Man.
Which is like a benzo.
Unbelievable.
Yeah. And I also got put on Seroquel for sleep, which if you read some of the literature is pretty much, contraindicated. You're not supposed to use that for sleep. Remeron, because I got put on Adderall because the benzos made me so depressed, but I couldn't tolerate SSRIs or SNRIs. I would have like some kind of reaction to them. Then
they were treating one side effect with another drug, right?
Yeah. And so because the Adderall made me not hungry and I lost all this weight, then they gave me Remeron to sort of stimulate my appetite. I mean, yeah, it was just like,
vicious cycle.
I think my brain just didn't know what to do. It was, stimulated and then it was tranquilized and, so I got really, really sick. And my father is a physician and he started to notice that something was wrong, that I wasn't myself at all. I was having, mood changes, and he happened to just find a journal article in Outside Magazine that was written by a guy named Matt Samet. And Matt told his story in this magazine. And my dad suspected that was what was happening to me and gave me the article, and I read it. And immediately I knew what was, after 5 years of chasing my tail with all these pills and doctors, because like Christy, I had gone to and had all kinds of medical testing. I had, upper and lower GI scopes. I was having steroids injected into my wrists because I was having excruciating like tendinitis and joint pains, which I think was also from benzodiazepine tolerance and interdose withdrawal. I mean, all kinds of doctors and specialists, dermatologists, because I had rashes everywhere. And that, Matt's article was like my light bulb moment. And
thank God that he wrote about his story.
Yeah. I mean, that's part of the reason I even tell mine, because I feel like if Matt wouldn't have told his, I don't know what would have happened to me. If I ever would have figured it out, I could have done 5 more years taking
and maybe
more pills.
and maybe ended your life.
Yeah.
But what a tragedy that the medications that they were giving you were making you sicker, and you and Dr. Huff both had to be your own detectives, right?
Yeah. Oh, totally. Yeah.
Nobody knew what was going on, except for finally the patient discovers this on her own.
Yeah. And the internet, you know, once I found Matt's article, I started digging around like Christy and was just blown away what was out there and what was possible from these medications.
Wow. I just feel, I don't know, my chest is tight just listening to this story. And it just feels demoralizing that you're a young person just fresh out of school. Everybody's got work stress. That's normal. You're learning a whole new profession, and patients are not always the easiest to deal with, and coworkers, and, so wow. But boy, were you ever over medicated and treated absolutely in a way that provokes the mind to think about malpractice.
Yeah. Yeah. I mean, I look back and I wonder, like, how did you think any of that was a good idea as the prescriptions were rolling in, like 6 by the end? But I describe it sort of like Christy, when she was saying about the interdose withdrawal. It's so bad that you take something, or you trust, if you don't know what it is, that you need help, or you need something to help yourself because you can't stand to even live in your skin, Right. So that, I think, is why I was just accepting the medications. And I was trained medically, so I trusted doctors. I have doctors in my family. So I thought, why would they be giving me something harmful? It didn't even cross my mind that this could be a harmful path to take.
Such massive ignorance among prescribers in this country. They don't know what they're seeing. I remember being referred a woman, and the therapist that referred her said she's suffering from anxiety and depression. And she walked into my office. She walked into the wall as she was coming into my office, sat down. Her eyes were all bleary, and she was slurring her speech. And she was prescribed a whole bunch of oxycodone and a whole bunch of Xanax and Ambien at night. And I mean, depression, anxiety, let's get rid of the pills and see what's underneath. Right. And she was a normal individual, high functioning once we got rid of all the pills. I'm sorry that you endured this. What a long, painful journey, right?
Yeah. Thank you.
Would you give me a couple of adjectives to describe this path you've been walking?
Yeah, sure. So one of them you said earlier in the podcast, which is inhumane. Yeah. I mean, I think it was needless and negligent, totally unfair, health ruining and life devastating. And for a long time, it was life threatening. I was suicidal and wasn't sure I was going to make it. The whole thing was isolating. It was horrifying, tragic, irreparable because of all the losses that I endured. It was enduring years and years and years of suffering, including the time on the pills, but also withdrawing from them. Totally exhausting. I would say, but at the same time, it was enlightening. I mean, I'm certainly not the same person as I was when this started, and I'll definitely not be the same type of provider once I get better and can go back to work.
You ever feel like you've been chosen on this planet to do a specific job?
I don't know. I don't know if it's that deep. I mean, I feel like I have to do something. Yes. But I don't know if there's any like purpose, I'll make purpose of it for sure.
That's for sure. And you're making purpose of it. And so is Dr. Huff. And that's so admirable, to take suffering and turn it into a meaningful existence that benefits other people. I have so much admiration for you guys. It's amazing. But yeah, I mean, this is not the path that anybody would choose. And you both speak about, years that you can't get back, and totally unfair. And you trust prescribers. And these are not medications that I've actually prescribed in my whole career, unless I'm taking somebody off alcohol or, using a Valium taper to take somebody off benzodiazepines, just because I've seen stories like, your own over and over and over and over. This is not a small problem. This is an epidemic in this country, and hundreds of thousands of people affected around the world. If there were 300,000, I think, reports, right, in the benzodiazepine FDA, I guess, search, the MedWatch that they took a look at before they
Yes, I think
updated
somebody from the Alliance for Benzo Best Practices counted and came up with 300,000 reports.
And that's only the reported ones, and that's only in the United States, right?
Right, just the United States.
Yeah. I mean, I didn't even know I could report benzodiazepine harm until I read it on your website. So, add a couple extra hundred in there, So Nicole, I guess you went to a detox because you were desperate to get off these benzodiazepines. Is that something you'd ever recommend somebody who's struggling to get off?
That's a hard no. I mean, maybe if, it's a rare case of a paradoxical reaction or some, extreme case, and there's just no other avenue. But most of the time, no. I would recommend people, getting as stable as possible. And that might mean, updosing a little bit if you're in severe tolerance, or spacing your benzo better, or, switching to a long-acting benzodiazepine like Valium, like Christy did, just to get yourself, as stable as possible. And then, the recommendation is a really slow symptom and patient-guided taper. And
you were in a detox for how long?
Well, I stayed for the full 30 days because everybody else, it's kind of sad. Everybody else in there was like graduating they had like tiers of who was moving up in their healing, and you could move off campus and all that. But I like never graduated to anything because I was so sick, and I was actually just getting worse in there, and they were trying new medications and things, and I was having severe reactions to everything. At one point, they gave me more Seroquel, and I busted my head open on the concrete floor and was sent to the emergency room for Seroquel overdose.
Oh, no.
So, man. I just was incredibly sick in that place.
Well, they should just have told you that it's inhumane to take somebody off that much of a benzodiazepine that you've been on for such a long term, in such a short period of time. They took your money, they took your time. And so this was a lot of intense suffering, and probably contributed to your protracted severe withdrawal.
Oh, I'm certain of it. Yeah. I mean, the shock to my nervous system was so severe. I developed akathisia. I mean, I paced until my feet bled. I was acutely suicidal. I was hysterical. My family had no idea what to do. I mean, they just discharged me after 30 days because that's, the standard. Your insurance will pay for however much, or they charge you for whatever and then send you home. And then it was on my family to take care of me. And I was in, horrific shape, begging to go to the emergency room every 5 minutes, threatening to kill myself constantly because it was just intolerable suffering.
I remember an 18-year-old that someone gave me to take care of a couple of years ago, and she had been prescribed Klonopin from the age of 16. She was like a 16-year-old kid who had a bad breakup with a boyfriend, a straight A student, normal kid, a little bit of breakup anxiety. And this child psychiatrist put her on Klonopin. And by the time I got her when she was 18, she was having panic attacks. She couldn't sleep. She was massively depressed. She was cutting herself, suicidal. I sent her to a rehab in Florida that took care of her for one whole solid year. And they did a long, slow Valium taper. But it's really hard to find that. I have parents calling me saying, I want to send my 23-year-old son to a rehab. We have to get him off this. He's on a combination of Adderall and Klonopin. He's been on it for years. Let's just get rid of it. We'll pay anything. And the truth of the matter is, I agree with you. There's no rehab that's going to be helpful, because it sounds like when you left the detox, you felt like you failed it. This was not a success.
Oh, not at all. And I actually wound up back on benzos anyways. So it was like just taking, thousands of dollars and flushing it down the toilet, because then I had to reinstate. And I found a psychiatrist like Christy did, who didn't really know, but she was willing to learn. And I taught her. I brought the Ashton manual. And then we reinstated me and did a taper after that, which the damage to my nervous system was pretty much already inflicted. I could only get but so much stability from reinstating the benzodiazepine, but it was enough to where I felt like I could still stay alive, essentially.
Boy, the two of you are certainly resilient. You're hanging on by the skin of your teeth, and when it certainly was dark for a long, long, long time, right? And what would you both, questions for both of you here, what would you say to the new prescriber fresh out of school, whether it's a nurse practitioner, a physician assistant, or a physician, regarding benzodiazepines and Z drugs?
Sure. So I'll start. So I would say, first off, if you're thinking about prescribing this to a patient because of the serious risk, please look for alternatives, especially non-pharmacologic options, because, our first job is to do no harm. And then, if you do need to prescribe a benzodiazepine, we really want to keep these prescriptions on a short-term basis, meaning less than 2 to 4 weeks, or preferably just intermittent use, like a one-time dose for flying or to stop an acute panic attack. And then we really need to make sure the patient is getting full informed consent about the risk of these medications. And I would even suggest written consent. I feel so strongly about this that I authored a consent form that's available on the BIC website that can be used in clinical practice. And, and now that we have the FDA box warning, we can encourage patients to read the information from the FDA as well.
Oh, I love that. So on the Benzo Information Coalition website, you've got a release or a informed consent form.
Yes, we do. It's on our resources page, and it's in printable form.
Okay. Oh, that's wonderful. And try your hardest to get the patient to cognitive behavioral therapist or a DBT therapist or some kind of psychodynamic talk therapy, or anything but just write a prescription and get the person out of your office.
Yeah. I don't think pills should be the first line when we have so many other options.
Absolutely. What would you say to someone out there who's saying, I'm having trouble finding a physician? My own primary care doc will not taper me with Valium. He won't do a long, slow taper. He says he doesn't know anything about it. And I can't find a psychiatrist to work with me. What do you say to somebody who's wanting to get off these drugs and can't seem to find anyone to help them?
Well, that's tough. I would say that you need to be persistent in looking for a doctor that can collaborate with you, because that doctor probably is going to be out there, and it doesn't necessarily need to be somebody that's completely educated on benzos. It just needs to be somebody that can, or is willing to listen to you and believe you and collaborate with you on a long, slow taper. We do have on our website a list of doctors, we call them benzo-wise or benzo cooperative, people that other patients have said have been able to help with a long, slow taper. So that's another resource that we have.
I love that advice. Keep looking until you find that person, because that person's out there. And I'll tell you something. I remember I was not an expert at taking people off benzodiazepines the first time I did it. I got a copy of the Ashton manual and I read it like a cookbook. And, it's like, okay, 2 milligrams of Klonopin is 40 milligrams of, Valium. And It's like, okay, go down by 10% per month. And this equals, and the patient will come in the office and say, well, what are we doing? I'm really anxious. I'm like, don't worry, I got this, but it's the first time I've ever done it. So anybody can do it. I mean, Heather Ashton has made it very easy.
I'll just add to that. It might not be a very popular comment, but you don't have to have a doctor. I mean, other than to prescribe the medication, there are people who just searched and searched and couldn't find anybody. And they didn't trust that if they told their current physician they were tapering, that they wouldn't, cut them off. So they just pretended to still be taking the medication, but they were highly motivated to get off, and they were self-taught and they did it at home. I mean, most patients are at home, doing this on their own. You're just lucky if you have a good doctor who's in your corner too.
And I don't object to that. Absolutely. It's better than them checking themselves into a detox and spending a lot of money for something that's going to fail or result in, damage to the central nervous system. Yeah. I mean, you've got your own withdrawal website, right, Nicole?
Oh, I co-founded the Withdrawal Project.
That's cool.
You can find it. Yeah, it's at withdrawal.theinnercompass.org, I think, or .com.
Wonderful.
I'm sorry, I can't remember.
Right. So yeah, patients are learning how to do this because doctors aren't willing or they're not educated in this. And I know that that's true because I have doctors, psychiatrists, and primary care docs calling me all the time saying, I've got somebody who's been taking years and years of Klonopin and Xanax, Ativan. Can you take this person off my hands? Or tell me how to do it. I have colleagues, friends of mine who'll say, help me with this. Give me a taper plan. Psychiatrists who want to work with their own patients. But yeah, they really are looking for some kind of guidance, So I love the articles that you both write on tips to help listeners through benzodiazepine withdrawal. So say you've got somebody right now and they're doing a long, slow Valium taper and they're suffering from anxiety and restlessness and they're depressed and their memory is still it's still foggy and they've got cognitive impairment and they're feeling like, wow, this is taking a long time. Any words of wisdom or any tips from either one of you guys?
Yeah, so I have some tips. I think the big thing to have is patience because this is going to get better over time. It just takes a long time. So you really just have to have the patience to get through it. And then as far as getting through it, I think developing coping skills is really important to deal with the symptoms. And everybody's going to be different as far as how best to manage the symptoms. And it just depends on what symptoms you're experiencing as well. But I know for me, personally, distraction was a great technique that I used to just take my mind off the symptoms. I mean, I would just sit and watch Netflix for hours on my really bad days, and it just took my mind off of it. And deep breathing was helpful sometimes. And then just really managing my overall stress level because stress only made the symptoms worse. And then I think having some level of support as well, finding other people that are going through this. I found some friends in the online support forums and we were at similar stages in our taper and we were able to, just talk each other through it. I still keep in touch with some of those people.
I love that. So distract your mind. How about you, Nicole?
Yeah, I would agree with everything Christy said for sure. I mean, I used all those coping techniques as well. I would say acceptance was huge for me. Just that I was strongly motivated. I wanted off of these things. And so I just had to accept that this was part of the way to get there. I did some very, gentle yoga techniques. When I got strong enough physically, I started walking a lot. There was many years I couldn't even do that. Like Epsom baths, although some people might say that they're scared of the Epsom, which, people can have reactions to all kinds of things when their nervous system is destabilized. So be careful about those kinds of things. Having a purpose. So that's why I got involved in the awareness and activism. But, take your time and, don't, care for yourself and rest as much as you can, put yourself first, and then, just do whatever you can to survive. I mean, for those who are suffering really, really bad, at my worst, I just showered 10 times a day and laid on the floor naked in front of a box fan and just didn't kill myself. So, whatever you have to do.
That's wonderful advice. And it puts it in perspective. It's a one day at a time thing for sure. And acceptance, radical acceptance. So it's radical acceptance in that you say, okay, this is the worst possible thing that could ever happen to me. I didn't want this. I didn't deserve this. And it's going to maybe take years. And I have to give up my job. And I I feel afraid all the time and I've lost years, but I'm going to radically accept it. And that alone decreases the suffering on some level, doesn't it?
Yeah, because I feel like the path of coming off, at least there was hope that I could be well again. But the path of staying on, if I chose that, was just a dead end. I mean, I was so sick on the pills. And so I had to accept, like you said, I'm choosing this path because there's hope in that direction, but I have to get through the worst suffering to get there.
And what do you offer through the Benzodiazepine Information Coalition? What does it offer somebody suffering from long-term benzodiazepine prescriptions?
So our website has a ton of information about benzodiazepines, all sorts of stuff, their adverse effects, how to taper off a medication. And it really applies to people that are already taking benzodiazepines, people that are wanting to come off them, or in the middle of a taper, even post-withdrawal. And we have an entire page of resources that we've collected, guidance on benzodiazepine prescribing. We have a free copy of the Ashton Manual, either PDF or Kindle form. We have that informed consent form that I talked about, links to online, and even a handful of in-person support groups. And a list of BenzoWise doctors. So we've got a lot of information.
That's amazing. That's wonderful. Are there recovery groups in person in New York City that I saw for people coming off of benzodiazepines? Or did I dream that? In my mind, I saw like some kind of, it's not Benzodiazepine Anonymous, but I wonder if there's an in-person support group in New York City. Did I see something like that on your website?
Yeah,
I would have to go back and look. I know there's one in Chicago for sure, because I know some of the people in it.
I think the New York one is new. A lot of times what happens is the survivors will start a group on their own, and they'll put it on, what is that website, Christy?
It's Warm Network, I believe.
Yeah.
Right?
Or they'll advertise it at one of the popular event places.
Okay. Yeah.
And then meetup.com, a lot of them get on there. And so and then people find it and say, oh, my local area has a support group, either in person. I know during the pandemic they were doing a lot of Zoom sessions and things like that.
That must be so comforting. I bet people in their living rooms are listening to you, feeling comforted by just listening to how healthy you sound and how good your concentration is, and how eloquent you sound, and how thoughtful and how calm and how high functioning you both are, having rebounded from this derailment. So you're just offering people a lot of hope just by listening. Nicole, I wonder, do you want to tell us anything about Medicating Normal? I know that you promote it and market it and do a lot of podcasts for them, Facebook work.
Yeah, sure. I mean, if you guys are out there and you haven't seen the film, you should. You can go to medicatingnormal.com/watch, where you can find all of the upcoming screenings that we're doing. And then if you go to the Medicating Normal Facebook page, about once a week, we do interviews with different professionals and people with lived experience around not just benzodiazepines, but all psychiatric medications. And Dr. Halligan was a previous guest, so you can see her interview. We have it on Medicating Normal's YouTube channel.
And it's interesting because the stories that I watched on Medicating Normal, I think do they follow 3 people, maybe 4 stories?
It's 5, I believe. Yeah.
Very similar to yours and Dr. Huff's. The anguish and the hopelessness and the fact that the psychiatrists were telling these people that they're kind of losing their minds, sort of patient shaming, right? Well, you have another mental disorder. And it wasn't that at all. The drugs were making them sick. So we're at the point where we're going to have to end the show. I could talk to you guys all day, but I just want to thank you both for coming on the show and sharing your stories of hope and resiliency. I think you're both heroic modern day heroes. And I think this transformation of your own suffering into a life of incredible meaning that helps other people, I think it's worthy of applause. So I'm super, super happy that you're both speaking up and advocating for those who can't speak for themselves, those who are losing hope and feel like they have nowhere to turn and no one to help them. So keep doing the wonderful work that you do. And to the listening audience, if you or someone that you love is suffering from long-term benzodiazepine prescription dependence or a severe protracted withdrawal, have a look at benzoinfo.com and check out this it's a wonderful resource. So thank you all for coming, and we'll see you all next week.
Thank you for joining us this week. Recovery, The Hero's Journey, is broadcast every Tuesday at 12 noon Pacific Time and 3 p.m. Eastern Time on the Voice America Health and Wellness channel. As you wait for our next program, remember, you are definitely not alone.